An estimated 6.7 million people in the United States experience an unruptured brain aneurysm each year. That's about 1 in 50 people. If not caught early and treated, these aneurysms can lead to debilitating damage or death. Today, we'll hear from a Long Island woman who suffered a brain aneurysm. But thanks to her persistence and the excellent care at Good Samaritan University Hospital, she's fully recovered and back on the tennis courts today. I also have great news to share about new cardiology services available that will help to heal hearts and save lives on the South Shore. That's all coming up today on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health, Stronger Together with Dr. Dave. We have an exciting show planned today with plenty of great information for our viewers. We'll start off talking about brain aneurysms, and there's no one better to discuss this than our first guest, Dr. Bekelis. He's the chairman of Neurointerventional Services at Catholic Health and the director of the Stroke and Brain Aneurysm Center of Long Island at Good Samaritan University Hospital. Thank you for joining us.
Thank you for having me, Dave.
It's an incredibly important topic that not too many people know about. We're going to be speaking about brain aneurysms.
Right.
And this is what you're well known for. This is your expertise. So let's just start from the basics. What is a brain aneurysm?
So a brain aneurysm is a very simple structure. Think of it as a balloon on the side of a blood vessel. If you have a soft spot, that spot enlarges, it becomes a balloon, and it's a soft spot, so it has a high propensity to rupture, bleed. And when that happens, you can have catastrophic consequences. So when an aneurysm ruptures in the brain, about half of the patients would die right away, and only a third will make it out of the hospital without any issues. So we're very aggressive about dealing with these problems before they become an emergency, before an aneurysm ruptures. And so, it's one of those things where people don't get a warning sign for, and often they're called a silent killer, exactly because you don't know you have one unless you're one of the lucky few that has a scan that detects a brain aneurysm, and then you know and you can do something about it.
So brain aneurysm is an enlargement, outpouching of an artery.
Exactly.
And
right.
the fear with a brain aneurysm, because we hear the word, people watching the show hear the word aneurysm all over. We can have an aneurysm in many places in the body.
Correct.
But the brain is particularly concerning because of the potential to rupture.
Exactly right. So in the brain, mortality or the chance of dying from a brain aneurysm rupture is very high. And so that's why when we find a brain aneurysm, we're very aggressive either about in terms of treating it or in terms of following it closely to make sure it doesn't reach a point where it's dangerous enough and can rupture.
What causes a brain aneurysm?
So that's a great question. We really haven't gotten the answer to that question yet, honestly. We believe genetics is what plays the majority of the role in developing and increasing your risk of a brain aneurysm rupture. But not a lot of environmental factors exist that can really put you at a higher risk to rupture a brain aneurysm. The only one that we know of consistently is cigarette smoking. That increases your risk of creating a brain aneurysm and also the risk of having a brain aneurysm rupture. And also high blood pressure increases your risk of rupture, but does not necessarily increase the risk of forming a brain aneurysm.
How common are brain aneurysms?
So brain aneurysms are extremely common. A lot of people argue about the true prevalence of brain aneurysms in the community. And so there's no definitive answer because most of the studies we have are cadaveric studies. But I would say a large number of the population is walking around with an unruptured brain aneurysm.
Can you explain, are there symptoms caused by brain aneurysms?
So brain aneurysms generally are silent. So they are in a location in the brain, in some of the arteries. They will grow unless they reach a very large size, at which point they'll start pushing on neural structures that are important. They will really not cause any signs or symptoms. Just before they rupture, we often believe they can cause increasing headaches. But really the only consistent and recognizable symptom that you get is at the aneurysm rupture. And what that entails is what we call the worst headache of somebody's life, right? And if people have chronic headaches and then they have a brain aneurysm rupture, they will always tell you this headache was different. It was different than anything I've had before. This headache is described as somebody hitting you in the head with a hammer. It comes in a split second from 0 to 100, and you can't miss it. Thunderclap type headache. And so these patients, they often they have this horrible headache. The ones that are in better shape obviously will just have a headache. Others will have nausea, vomiting, dizziness, pain behind the eye. Some will pass out, and some will die right away. And in those cases, it's often mistaken for a cardiac arrest event because they're found pulseless. But it's typically the brain aneurysm ruptures, and the impact is so severe that people just die right away.
Is there anything about brain aneurysm headaches that we should be aware of?
Yeah, so there's nothing really that makes those headaches special in general, other than the rupture headache, which, like we said, the worst headache of your life, and in that case, it's unmistakable. But if folks have chronic headaches, right, and they are changing in nature, they're becoming more intense, they're becoming different. That can be a million different reasons why that is happening, but in those cases, I would say it would not be it would not be wrong to scan somebody to see if they have a brain aneurysm. Also, that particularly applies to folks with family history of brain aneurysms that, of course, are at a higher risk to form a brain aneurysm. Those cases, and screening is very straightforward in this population. It's in the form of an MRA. An MRA is an MRI without contrast most of the times. That's looking specifically at the blood vessels of the brain. So no contrast, no radiation, simple test. You can get an answer right away. It can pick up aneurysms as small as 1 or 2 millimeters, and it's a very effective test. And we often do that in families with brain aneurysms. If somebody's having headaches, we often screen them and get an answer.
So if somebody's having a headache and it changes or it's not going away or it's getting worse, they should at least let their physician know.
Absolutely.
Right.
In that case, I would say the primary care doctor needs to be aware. And I would say, especially on Long Island, primary care doctors are very much attuned to the possibility of brain aneurysms. They're very good about either getting these scans or engaging us, and then we do the workup and screen these patients.
Gotcha. So you have a patient, they have an aneurysm. So what's the next step? Do they all need to be treated?
Great question. So not every aneurysm needs to be treated. We look at every brain aneurysm in an individual way. We take into account whether folks have had other brain aneurysms in the past that have ruptured or not ruptured, and this is a new aneurysm. They've had somebody in the family with a brain aneurysm, whether they're smokers. The size of the aneurysm is important. The smaller the aneurysm, the smaller the risk of rupture. The larger the aneurysm, the larger the risk of rupture. The morphology of the aneurysm is important. A smaller aneurysm with irregular morphology, obviously more dangerous than a relatively little larger aneurysm with smooth morphology. And so all of these are taken into consideration. And then the first step, generally speaking, when we're trying to decide whether we need to treat a brain aneurysm or not, if we think that brain aneurysm is a possible candidate for treatment, is a diagnostic angiogram, which is a simple procedure we do through the artery in the groin or the wrist. We navigate our catheters or wires all the way up into the chest and the neck area, and we shoot contrast, and we take X-ray images of the brain aneurysm, typically 3D images, and those will tell us exactly the size, the morphology, the location, and we can risk stratify a little better and determine the type of treatment somebody would need if they need treatment. But I would say, in looking at all the aneurysms we see in the office, only about 10 to 20% eventually end up going down that path. The majority of them we can follow non-invasively for a very long time.
So people shouldn't be afraid of being diagnosed with a brain aneurysm. As long as they're being followed, the vast majority, as you said, won't need anything.
Would not need absolutely anything. And I often tell patients, they come to me, stressed, and obviously, you get a diagnosis that sounds horrible, and you go online and you look into what a brain aneurysm is and what can happen from it, and people panic, right? And so we try to get people in the office very quickly after a diagnosis like that, mainly to reassure them,
right?
Because the majority of them will not need anything. We'll shake their hand and tell them I'll see you in 6 months. But there's what I tell them is a blessing in disguise, right? Obviously it'd be ideal not to have a brain aneurysm, but if you do have one, it's better if you know about it, you monitor it, and if it reaches a point that it becomes dangerous, then we would follow the path to treat it. And treatment these days has been a lot better than I would say 10 years, 20 years ago. It's becoming a very simple procedure to treat a brain aneurysm.
Tell us about the treatment. How has it changed?
So, and that's one of the first things I tell patients. The majority of the times we don't have to open the head to treat a brain aneurysm these days. We still do it for very few aneurysms that are very difficult to treat any other way. But similarly to the diagnostic angiogram, we treat brain aneurysms through the artery in the leg or through the artery in the wrist, navigate again our catheters and wires all the way up into the brain vasculature, into the aneurysm, into that balloon, and we treat it either by staffing it with platinum coils, which, if you think of it as a balloon, you stuff it from the inside and you clot it off. Or we use stents to divert the flow away from the aneurysm and allow the aneurysm to progressively clot off and eventually get cured. And there's different iterations of the endovascular techniques, like we call them, that we can treat brain aneurysms. I would say over 90-95% of brain aneurysms these days that need treatment end up being treated in an endovascular way. And most of these folks would come to the hospital, they'll have a needle stick in the groin, not even an incision, and they'll go home the next morning. And frankly, most of them complain because they feel like nothing dramatic happened in regards to the brain aneurysm.
Amazing. So you're basically saying they get a needle stick in their home in a day or so.
Correct.
Unbelievable. And this is a cure. You're curing these aneurysms.
Correct. So these treatments are curative for the aneurysms. And I would say every year this is a very interesting field because every year it advances dramatically and we have newer tools all the time to treat more and more brain aneurysms without the need for open surgery. And now we're looking about 95% are getting endovascular treatments. I would say if we have this conversation in a year or two, we'll be looking into 96, 97%. Eventually, the goal obviously is to treat as many patients as we can in the least invasive way possible.
We're excited to have you here in the community, and I'm really excited to have you back on the show and hear about all the cool stuff you're doing in the near future.
Absolutely.
Thanks for joining us today.
Absolutely.
Coming up next, we'll hear from a patient who is treated by Dr. Bekelis and his team at the Stroke and Brain Aneurysm Center. She'll share her story with us and has some advice for those who may have similar symptoms. We'll be right back.
For more than 100 years, American Humane Association has been teaching kids to be kind to animals. Those in our homes, on the farms, on the silver screen, and wildlife conservation, caring for the world's vanishing creatures. But we can't do it alone. Visit kindness100.org to find ways to teach kids how they can make a more caring, compassionate, and humane world for all of us.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. Dr. Kimon Bekelis is the chairman of Neurointerventional Services at Catholic Health, and he just provided some great background information about brain aneurysms and what causes them. Now, we're going to hear from one of his patients. Joining us now is Maria Rizzuto, a brain aneurysm survivor and vocal supporter of aneurysm awareness. Take us to the beginning of your story and how you eventually wound up meeting with Dr. Bekelis.
I was having some headaches and some ear ringing, and honestly, I think that it was divine intervention because I kind of knew that there was something going on in my head and I needed to find out what was going on. I was telling my husband, I think I have a tumor, and he was like, "Oh, you're fine, don't worry about it." But I was like, no, I feel there's something terribly wrong with my head. So I started asking and going to see doctors, and a lot of them would be like, "Oh no, you're fine. You're too young, and you don't need a scan or an MRI or whatever." And I would go to the next one, and I would ask them. I would tell them my symptoms, and they were like, "Oh no, it's unrelated. Don't worry about it. You don't need one." So then finally, I went to like the third one in Manhattan, trekking all the way into the city from West Islip, and they performed an MRI. No, actually, first it was an MRI, and a week later I go back and I'm sitting at the table and she's like, "Well, I don't want to worry you, but you have an aneurysm." And I was like, "Excuse me?" First of all I heard was, "You're dead." One was saying one thing, and correct me if I'm wrong, doctor, the aneurysms, whether it's inside the cavity or outside the cavity, is a very big difference.
Correct. If the aneurysm inside the brain, it can have the potential to have a catastrophic complication. If it bleeds, if it's outside the brain, it's more manageable with monitoring and not much worry.
And where was your aneurysm? Was it inside the brain or outside
So that was
the
the
brain?
problem. I would go to one doctor and they would say it's inside the brain, and then I would go to another doctor and they would say it's outside the brain.
But you didn't even have a good diagnosis. You didn't even know what you had, really. No. You knew you had an aneurysm. You weren't sure where it was.
Now I'm living with a ticking time bomb. I'm thinking, when is this going to decide to erupt? When I'm traveling, I'm looking at the closest hospital that's next to the hotel. When I'm angry and my blood pressure is going up, I'm Greek, it happens a lot. Is today going to be the day? Yeah. I had small children, and it was just a constant worry. I go, I have my scan done, I get my report in my patient portal, thank God. And now I'm reading it, and now I'm the doctor. And it says that it's doubled in size, and it's inside my brain. At that point, we were doing virtual visits still. So I spoke to someone at another world-renowned hospital in the city, and again, here we go, inside the brain, outside the brain. I was like, oh my God, here we go again.
So there was still discrepancy.
It's very, very difficult to comprehend while you're in it.
You meet Maria. What was your impression?
So obviously, long story, right? So I had to review a lot of scans. What happens often is when you do a lot of scans, unless you look at the scans yourself, sometimes the radiologist compares the most recent scan to the current scan, and so that there might not be substantial difference between those two scans. But if you look at the first scan and the last scan, then you see the doubling in size. And I think that's a common problem when you follow up somebody for a long period of time. You might miss something like that way. The truth of the matter is you cannot really tell by an MRI whether the aneurysm in that particular location is inside or outside the brain. You have a suspicion about whether it's inside or outside the brain. And the definitive answer comes from a diagnostic angiogram, which we discussed about earlier. And that's what we discussed. Obviously, when I met Maria, she was frustrated with the whole adventure that she's been through. And I told her very simply that I could give her an answer about whether it's in the brain or outside the brain with an angiogram, and depending on what that showed, we could decide whether she would benefit from treatment or not. And I also reassured her that the treatment is very straightforward if she were to need treatment.
Right, straightforward in the sense that you thought maybe, well, depending on the location, you would know.
And I knew the location would be a fairly straightforward approach to treat it.
So you do the cerebral angiogram. And what was the result?
So the aneurysm was in the brain.
Okay.
Right.
So worse than we would expect, and against what some other people were telling you.
And it confirmed the size was larger than the very first scan that Maria had, and we had a conversation at the time, I think, on the table. And
I remember saying, "Can you fix it now?" I'm here.
Which is a little challenging, but so the treatment option for what Maria had, past tense, is what we call a flow diverting stent, which we talked about earlier, which is a stent we place in the parent vessel, not inside the aneurysm, and that allows the blood to flow away from the aneurysm, and eventually the body seals off that soft spot. And so it's a curative treatment for brain aneurysms, and eventually completely gets rid of the aneurysm.
How was the experience?
He stented my aneurysm, and I woke up, and I felt great. The nurses, the neuro nurses, were just amazing. I wanted to take them home with me. I didn't know what to do to repay them for their kindness. That hospital is amazing. I could just say that. And people think that they have to go for care into Manhattan, but my answer was right there in West Islip at Good Samaritan Hospital. And I was very lucky, and I thank God every day that I was able to get the treatment and to meet Dr. Bekelis. I went home, and I think the recovery must have been like 6-7 days. And I called him because I'm an avid tennis player, and I'm like, can I go back on the court? I feel great. I was back on the court playing tennis 5 days a week. And I just want to tell people who are listening, there's treatment, there's hope, and we need to do a better job of awareness.
You have to be an educated consumer and continue advocating for yourself.
I have hopes that if I can save one person's life from this information, I feel like my life is worth living, and I've done my job.
This is an inspiring story, and like I told Dr. Bekelis earlier, it's amazing that we have him and his team right here on Long Island
God bless him.
I mean, I think people are going to start coming to Long Island from all over the place soon to get this level of care.
It was so personal and so loving and so caring at Good Samaritan Hospital that honestly I wouldn't go anywhere else.
And if anybody watching this show right now has been diagnosed with an aneurysm, has a family history of an aneurysm, is not sure and they're nervous about having an aneurysm, what's the message?
Call Dr. Bekelis.
Okay, call Dr. Bekelis and advocate for yourself. Well, thank you for joining us today.
Thank you so much, and thank you, Dr. Bekelis, for saving my life.
Thank you, very sweet. Thank you.
And we'll have to have you back on and hear about your website once you create it and all the great things you're doing.
Anytime.
All
Thank
right,
you for
thanks
having
joining
me.
us. We have to take another quick break, but when we come back, I have more great news about a new cardiovascular service that will help save lives on Long Island. You're watching Stronger Together with Dr. Dave.
Or that the projections would be blood next Thursday?
I can't do Thursday, but I can do Friday.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. St. Francis Hospital and Heart Center provides world-class cardiovascular care, and now you're able to receive that same high-quality level of care in more locations that are convenient to you and your loved ones. Catholic Health recently opened the St. Francis Heart Center at St. Joseph Hospital in Bethpage with the introduction of a new cardiac catheterization lab. This allows the Bethpage Hospital to offer life-saving procedures such as percutaneous coronary intervention, also known as PCI, to patients who present at the hospital with a heart attack or other significant cardiac issues. Physicians can also perform an intervention to open the artery through stenting when disease is discovered during a diagnostic catheterization. That's key because the capability to restore blood flow and save the heart muscle for patients within 90 minutes is critical. For more on the services available, let's hear from members of the St. Francis Heart Center team at St. Joseph Hospital.
I think it's exciting to be able to extend the care of the St. Francis brand now to St. Joe's with opening the cath lab here. As you're well aware, I think that on Long Island, the care we provide at St. Francis is really second to none. And to now being able to provide a similar type of care in the community will make a big difference for the locals.
Catholic healthcare, and particularly St. Francis, kind of written the book on how cath labs should run well, and all that training is being done by those people. So we have experienced people coming in and starting the lab, and I think that's the best way to start it. And then the local people and the other people that we're adding to it, we're going to train as we go. But starting with experienced staff, I think it will improve our outcomes.
So opening up a program like this here, this will only just improve the care, cardiac care in this part of Nassau County.
What a wonderful resource, and the best part, it's already saving lives. Next up, we're going to hear from a man who recently celebrated his 52nd birthday thanks to the St. Francis Heart Center. That story is coming up after the break. You're watching Catholic Health, Stronger Together with Dr. Dave.
As farmers and ranchers, stewardship of the land comes naturally. Your work keeps our water clean, improves the soil, and enhances wildlife habitat. It also provides countless benefits, not just for you and your family, but for millions of Americans who depend on this region every day without even realizing it. Thank you for being stewards of America's prairie, for all of us. Take a moment and find out how conservation pays. Visit conservationpays.org.
This is my new best friend, Esther. She might look like any normal, playful puppy, but Esther's being raised to become a canine companions for independence assistance dog for a person with a disability. To get there, she needs lots of loving care and attention, plenty of exercise, and good eating habits so that she can live a long and healthy life for her future family. Visit cci.org or call 1-800-572-BARK. Raise a puppy, change a life. You can make a world of difference in the life of a person with a disability.
What a wonderful resource, and the best part, it's already saving lives. Although the lab has been treating patients for several months, they recently started to treat emergency STEMIs, which is a complete blockage of the heart's artery. The first patient they treated recently returned to the hospital to celebrate his birthday with his care team. Catholic Health's Tim Kelchner brings us this special story about a heart attack survivor with a second chance at life. Take a look.
Monday, March 20th was a special day for the medical team here at Catholic Health St. Joseph Hospital. They opened this beautiful new cardiac catheterization lab for emergency cardiac patients. And because of their excellent care they provide, it was also a special day because it allowed Babar Majid to celebrate his 52nd birthday.
Birthdays are always worth celebrating, especially when you have a lot to be thankful for. And today, 3 weeks after being treated for a heart attack, Babar Majid has returned to St. Joseph Hospital. For Babar, March 20th is the day that he received a second chance at life.
It was a Monday, it was March 20th, it was the day that we were opening our cath lab for STEMIs. I'm actually the director of the ED and the cath lab. It was a normal day, and we all just left. It was after 6 o'clock, and we had the page that there was a STEMI going on.
Upon arrival to our emergency department, an EKG was immediately performed, and the results prompted our STEMI protocol to be activated. It was determined that Babar was experiencing a STEMI heart attack.
It was very kind of, I was about to be gone from this world.
Showing up in the ER, they had everything ready, looked at the EKG. I leaned over to him and said, "We're gonna have to fix this. We can take care of you." And he was sweating a lot, was very anxious, went right into the room, and we got to work.
We have metrics that typically you have to have a door to balloon or intervention within 90 minutes. That's the national benchmark. Our internal goal is 60 minutes. We did it in 58. So for the very first emergency procedure, our team worked splendidly.
I think it's blessing that I'm here, and they brought me here.
Having St. Francis Heart behind us has been the best thing that's happened to this hospital. I mean, besides having the best equipment available, we have the best nurses, and we have doctors that are experienced.
Where does this rank on list of all-time birthdays?
The highest one right now, the top, you can say out of 10 is that one. That's where I am. But it's really great just to coming and feeling my 52nd birthday is really, it's a big thing for me. It's a very big thing.
What a wonderful story. Thank you to all my guests. We hope you've enjoyed this segment of Stronger Together with Dr. Dave. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.